Welcome back guys. Now in this video, let's begin with the topic of platelet disorders. Now guys, before discussing about the platelet disorders, first we should know what is the normal function of the platelets. Okay, so first let's discuss about the topic of hemostasis. Okay, hemostasis. Don't confuse with the homeostasis. That's a totally different thing. Okay, this is hemostasis. See, let's put it this way. When there is a damage to a blood vessel, okay, whenever there is a damage to a blood vessel, what should happen? Do you think continuously blood will come out? Okay, and I will be drained out of all this blood. The blood is going to drain out of my body, 5 liters of blood. No, it won't happen, right? So the blood vessel is going to seal within the next 2 to 5 minutes. The blood vessel is going to seal so that there won't be no longer hemorrhage happening. There won't be any hemorrhage that is continuing. Okay. So whenever there is a damage to the blood vessel, immediately the platelets will come to that area of damage and the platelets will seal the bleeding blood vessel and the clotting factors are activated and the clotting will happen over that area. Okay. So this is called as hemostasis. Okay, forming the blood clot, preventing the loss of the blood. Okay. So how exactly this hemostasis happens, sir? And how many stages are there in the hemostasis? Okay. Now there are actually 2 stages in the hemostasis. What are they? They are primary hemostasis and secondary. See, now itself I am telling you, the primary hemostasis is totally dependent on platelets. Okay, platelets are involved in the primary hemostasis. Then who is involved in secondary hemostasis, sir? In secondary hemostasis, the clotting factors, okay, are coagulation proteins, or let me put it this way, clotting factors. Clotting factors are involved in secondary hemostasis. Now what exactly is primary hemostasis and what exactly is secondary hemostasis? See, now this is a blood vessel, sir. Okay, here is a blood vessel present. Now blood vessel is lined by which cells? So blood vessel, everyone knows, they are lined by this endothelial cells. Okay, here are the endothelial cells. Now these endothelial cells, they are lying on what? Down to the endothelium in the vessel wall. Okay, in the vessel wall itself, there is something called as subendothelial collagen. Okay, the vessel wall is made up of the collagen. Now down to the endothelium there is subendothelial collagen which is not exposed, which is covered by totally by the endothelial cells. So endothelial cells are covering the subendothelial collagen. Okay. Now in your blood, who are there? Clotting factors are there. Okay, there are different types of clotting factors. And also there are platelets. Okay, the platelets which I am showing here, these thrombocytes, small, these are not the, they are of different shapes. Okay, these are not the RBC, these are the platelets. Okay, so these platelets are also there. So in an intact blood vessel, the platelets are not attaching with one another. The clotting factors are not activated. They are always in inactive states. Okay, platelets are also not attaching with one another. They are completely doing their job, simply going through the blood vessel. Okay, they are simply circulating. What is the normal level of platelets? See, the normal value of the platelets is somewhere between 4 lakhs to 5 lakhs. Okay, 4 lakh to 5 lakh platelets per microliter. So this many platelets are there and they are doing simply their job. They are simply traveling within the blood vessel. Now what happens is, sir, there is a damage to the endothelium because of some reason. Okay, because of some reason there is damage to endothelium. Let's put it this way here. Now here the endothelium is damaged. Okay, now the endothelial lining is damaged. Now what happens? See, when the endothelial lining is damaged, now this damaged endothelial cells, now they are damaged. Now what happened for the first time? See, the subendothelial collagen is getting exposed. There is exposure of the subendothelial collagen to the clotting factors. There is exposure of the subendothelial collagen to the platelets. Now this damaged endothelial cells, they are going to release certain substances. Already in this endothelial cells, there are certain vesicles. So these vesicles are called as Willebrand bodies. These are called as Willebrand bodies. Now in these Willebrand bodies, do you know who is there? So there is presence of this molecule, is pink color molecule which I am showing here. This is called as von Willebrand's factor. Now these damaged endothelial cells, they are releasing this von Willebrand's factor. Now this von Willebrand's factor is going to come and bind with the subendothelial collagen. It's going to stick with the subendothelial collagen. Okay. Now I am starting with the primary hemostasis. See, so vessel is damaged, endothelium is damaged. Now what happens? Let's start with the primary hemostasis. So now what happened? There is release of von Willebrand's factor from the vival pellet bodies. First thing. Next what happens is the platelets which are present in the blood vessel, which are present in the plasma, which are simply going through the plasma, platelets attach with von Willebrand's factor. Okay, whenever they see the von Willebrand's factor, the platelets will come and bind with the von Willebrand factor. So I will just show it here. See, imagine this is the von Willebrand's factor. Okay, here I am showing you von Willebrand's factor, sir. Okay, von Willebrand's factor. To this von Willebrand's factor, who is coming and binding? This is a platelet. See, imagine this is a platelet. This platelet, it is coming and binding with the von Willebrand factor with the help of this receptor. So this receptor is called as, okay, this receptor is called as GP1B. So with the help of GP1B, the platelet is coming and binding with the von Willebrand factor. This process is called as platelet adhesion. Okay, so platelets are attaching with von Willebrand factor, leading to which process? Adhesion. Okay, adhesion is just like one layer. Okay, so on the down there is von Willebrand factor everywhere. So platelets are coming, one platelet is coming and binding with the von Willebrand factor. Now after this, platelets are activated. See, now this adhesion is going to bring the shape change. Now it is going to make these platelets activated. Now these platelets are activated. Now platelets, they are just like a gang. Okay, they are just like a gang, sir. Now these platelets, see, for example, to this von Willebrand factor, what happened? Platelet is coming and binding. Okay, platelet is coming and binding. See, imagine this is a platelet. It is coming and binding with the von Willebrand factor. Now, do you think this 2-3 platelets, whatever are coming, okay, are going to completely seal the damage area? No, they require more and more platelets. So more and more platelets should come here, and all these platelets should come and seal the damage area. So now what happens is, sir, this activated platelets, okay, these platelets which have undergone adhesion, they will undergo shape change. Okay, this adhesion induces shape change, and these platelets will release certain important substances like ADP, okay, ADP and thromboxane A2. Okay, so now the platelets which have adhesed, which have undergone adhesion, now these platelets are releasing these two substances which are called as ADP and thromboxane A2. These are just like a messengers. Okay, these are just like these platelets are giving a call. Okay, these platelets are giving a call. So as we are discussing, see, this ADP molecule and thromboxane A2, they are going to give information to the other platelets. They will call the other platelets to come and cause the aggregation. Okay, so for example, let me put it this way. See, this is the platelet. Okay, what exactly is this thromboxane A2? I will explain you. Look at here. See, imagine this is a platelet which have undergone adhesion. Okay, this platelet have undergone adhesion, sir, with von Willebrand factor. Now, in this platelet, see, this platelet is having this cell membrane, right? Now, in the cell membrane, who is there? Phospholipids are there. Phospholipids. These are there. Phospholipids, when they are acted upon by an enzyme called as phospholipase A2, in the name itself it's there, see, phospholipase is going to break down the phospholipids. Now the phospholipids, whenever they are broken down, they will be converted into a substance called as arachidonic acid. Okay, now all this is happening within the platelet. Now this arachidonic acid, now it's going to convert, like this arachidonic acid is entering into the cyclooxygenase pathway. So now you are going to have prostaglandins. okay, prostaglandins. Now these prostaglandins, now they will enter into thromboxane synthase pathway, okay, thromboxane synthase. Now when these prostaglandins, whenever they are acted upon by thromboxane synthase, now who is going to be produced? Thromboxane A2, okay, thromboxane A2. So this is the enzyme. So this enzyme is thromboxane synthase, or in specific this is thromboxane A2 synthase. So all this is happening within the platelet cell. So the platelet is producing the substance, okay, thromboxane A2. So what is the function of this thromboxane A2? Now this thromboxane A2 helps in platelet aggregation. Okay, it helps in what? It helps in platelet aggregation, right? So what exactly is platelet aggregation? Now I have already explained, you see, adhesion, you know it. It's the release of the von Willebrand factor. Von Willebrand factor is going to bind with the platelets. So once the platelet bind with the von Willebrand factor with the help of GP1B, the platelets will undergo shape change and the platelets are going to release molecules like ADP as well as thromboxane A2. Now this ADP and thromboxane A2, what they will do is they will call the other platelets to come and join this area of the damage. So now what happens is, look, imagine here is von Willebrand's factor. Okay, all these are the von Willebrand factor molecules. Now this von Willebrand factor, now they are attached with what? They are attached with the platelets. Now imagine these are the platelets. Okay, so the platelets first which came and have undergone adhesion. After adhesion, what they have released? ADP as well as thromboxane A2. Now multiple platelets, see, now multiple platelets are going to come to this area and will bind here. So one platelet is going to bind with the other platelets. Okay, now multiple platelets are binding with one another like this. So now what is happening? That like just like a meeting. Okay, now multiple platelets are coming and binding this area. So if thousands and thousands of platelets if they are coming here, means what happens? That area is going to become closed. That area is getting closed now. So this process is called as platelet aggregation. Okay, what is this? This is platelet aggregation, sir. Right. Now my question to you is, sir, how this platelet aggregation is happening? With which molecule? Platelet aggregation, look, one platelet is going to bind with the other platelet molecule. Okay, one platelet is going to bind with the other platelet molecule with the help of this linker. Okay, with the help of this receptor, there is a receptor by which one platelet is binding with the other platelet. So this molecule is called as GP2B3A. Okay, GP2B3A. With the help of GP2B3A, what is happening? Platelet aggregation. Okay, platelet aggregation is happening. Platelet adhesion, look, platelet adhesion is with the help of GP1B. Platelet aggregation is with the help of GP2B3A. Okay, platelet adhesion completed, platelet aggregation is also completed. So with this, primary hemostasis is done. Okay, primary hemostasis is completed. Now one important point which I want you to know is, sir, here one platelet is binding with the other platelet. Okay, one platelet is binding with the other platelet. Look, so here is the one platelet. Okay, so this is one platelet, this is GP2B3A, here is the other platelet, here is one more GP2B3A. Now this GP2B3A and this GP2B3A, they are going to come close together and platelets are aggregating. But in between there is a linker molecule helping in this aggregation. So this linker molecule is nothing but fibrinogen. Okay. So at the end of the day, the simple point which I want you to know is this: platelet aggregation is happening with the help of GP2B3A by using fibrinogen as a linker molecule. It is coming and just helping in the binding process of just to this GP2B3A molecules. Okay, so fibrinogen is there. At the end of the day, in secondary hemostasis, this fibrinogen will be converted into fibrin, so that this bond will become strong. Okay, so primary hemostasis completed, sir. So primary hemostasis is all done by the platelets. Two important steps: platelet adhesion, platelet aggregation completed. Next, discuss about the secondary hemostasis. Secondary hemostasis. In secondary hemostasis, what exactly is happening? It's all done by the clotting factors. Clotting factors. So now you know what is happening in the secondary hemostasis. Clotting. How many clotting factors are there? See, if you look at the number, it will look as 13 clotting factors are there, but in reality there are only 12 clotting factors. Okay, there are 12 clotting factors, right? Now, but number is looking like 13. Who is missing then? 6. Clotting factor number 6 is missing. Number 6 clotting factor is missing. So what does this clotting factors are doing? What is the purpose of this clotting at the end of the day? See, at the end of the day, the aim of clotting is to convert soluble fibrinogen into insoluble fibrin. To convert soluble fibrinogen, see, this is a protein, it's a clotting factor. Okay, clotting factor number 1, which is inactive, ogens are inactive. To convert the soluble fibrinogen into insoluble fibrin strands. So that's the purpose, or that's the aim of the clotting, secondary hemostasis. So how this will occur, sir? How it will happen? It happens in 2 pathways. Okay, it happens in 2 pathways. One is intrinsic pathway and extrinsic pathway. So let me write the pathways. How many pathways are there? 2. What are there? Intrinsic and extrinsic. So intrinsic pathway and extrinsic pathway. Okay, intrinsic and extrinsic pathway. So what is intrinsic pathway and what is extrinsic pathway? In the name itself it says, see, extrinsic and intrinsic. Intrinsic means something within the blood vessel is starting the pathway. Extrinsic means something outside the blood vessel is starting the pathway of clotting. Okay. Now, let me put a blood vessel here. Okay, this is a blood vessel. Alright. Here are what? These are the endothelial cells. This is a damaged endothelial cell. Okay, like this. Now, here already platelet adhesion and platelet aggregation completed. Say, for example, all these are the platelets. Okay, platelet adhesion completed, platelet aggregation also completed. Now, platelet aggregation completed, right? Now, when the platelet aggregation is completed, now that area is sealed or not, just tell me. That area is sealed with this platelet plug. Now, platelet plug is formed. So, that's the aim of primary hemostasis. See, the aim of primary hemostasis is platelet plug formation. So, the aim of primary hemostasis is platelet plug formation. My question to you is, so here platelet plug formed, right? Then what is the point of doing secondary hemostasis? Now, my question to you. So, you want to build a home for yourself, okay? So, you are just building a home with the bricks. You are trying to build a home with the bricks, okay? You are just putting brick together. Now, do you think that home is going to be a stable home? Is it going to be strong enough? Only with the bricks, one brick on other. Can you make a home out of it? Definitely not. It's not going to be stable. Okay. So in the same way, this platelet plug, whatever is there, yes, it's trying to hold the blood from leakage. It's trying to prevent the blood loss, but it's not a strong thing. It's not stable enough to hold the blood. Okay. So at any point of time, because of the pressure, hemodynamic stress, it can simply move away. It can go. So what we need to do is we need to stabilize it. We have to put some cement here. Okay, to make a wall strong, how strong? You need to put cement. In the same way, here you need to put cement. What is that cement, sir? Clotting factors. It's the clotting factors. We need to convert the liquid clotting factors, that's a soluble fibrinogen, into insoluble strong fibrin strands like a steel vise. We have to make the fibrinogen into fibrin, so that this fibrin is going to make a perfect clot, so that it will get a proper strength. So the aim of secondary hemostasis is to convert soluble fibrinogen into insoluble fibrin and making the clot stable. Okay, so it's stabilizing the clot, so stabilization of the clot. That is the aim of the secondary hemostasis. So how many ways it will happen? two pathways, intrinsic pathway and extrinsic pathway. So first let's begin with the intrinsic pathway. How intrinsic pathway begins is, see, when the vessel is damaged, look here, when the vessel is damaged, for the first time the subendothelial collagen is exposed to the plasma. The subendothelial collagen, look here, the subendothelial collagen is now getting into contact with the plasma. Okay. Now plasma, in the plasma who is there? Clotting factors are there, inactive clotting factors, they are sleeping. Inactive clotting factors are there. Now those inactive clotting factors, when they come into contact with the subendothelial collagen, look. So let me write here subendothelial collagen. Now the subendothelial collagen is going to start the intrinsic pathway. So what will happen in the intrinsic pathway, sir? Let me explain you the entire clotting cascade in a simple way. Always write 10 in the center. Okay, always write 10 in the center. So how many clotting factors are there? Just tell me. Total, how many clotting factors are there? 12 are there. So write 12. Before 12, which number is there? 11. Before 11, which number is there? 10. Already written over here. Before 10, 9. Before 9, 8. So done. Before 8, which number is there? 7. Okay. Now 5 2s are how much? So 5 into 2 into 1. Sir, 5 2 into 1, 5 2 into 1 is 10 only, right? So same 10. So whatever I have shown you here is intrinsic pathway, this pathway which I am mentioning here, intrinsic pathway. Okay, intrinsic pathway. This pathway which I am showing here is extrinsic pathway. Okay, intrinsic pathway and extrinsic pathway. First let's discuss about the intrinsic pathway. So what I am discussing here is, see, it's the subendothelial collagen, the exposed subendothelial collagen. When it comes into contact with the clotting factor number 12, it activates the clotting factor number 12. Previously it is inactive. The clotting factor number 12 is previously it is inactive. Now the subendothelial collagen is activating the clotting factor number 12. 12 activates 11, 11 activates 9, 9 activates 8. So 8 activates 10. Now from here this is called as the common pathway. Once 10 is activated, this pathway 10, 5, 2, 1, this is called as the common pathway. Okay, this is the common pathway of clotting cascade. At the end of the day, look what is happening. Sir, is a 2 which is called as the thrombin. 2 is thrombin. Okay, now prothrombin is going to be converted into thrombin. Okay, it's 5, the clotting factor number 5. What it will do? 5 activates 2, which means the prothrombin will be converted into thrombin. Now you have the thrombin. Thrombin, what it will do? What is the last step? Sir, it's the thrombin converts soluble fib. Okay, soluble fibrinogen. Okay, soluble fibrinogen into insoluble fibrin. Okay, insoluble fibrins. Done. So the last step is completed. Now tell me, who is activating the intrinsic pathway? Subendothelial collagen is activating the intrinsic pathway. Which clotting factors are involved in intrinsic pathway? 12, 11, 9, 8. 12, 11, 9, 8. Then what is extrinsic pathway, sir? See, in the name itself it says extrinsic, something out of the blood vessel. Intrinsic, something within the blood vessel, means the subendothelial collagen which is present in the blood vessel is activating the cascade. So intrinsic pathway. And what is extrinsic pathway? See, it's the damaged tissues. Whenever there is a trauma, not only blood vessel is damaged, but surrounding tissue will also be damaged, right? So damaged tissue, let me write here, damaged tissue is going to leak something called as tissue factor. From the damaged tissue, who is coming? Tissue factor is getting released. Sir, now this tissue factor is coming and activating the factor number 7. So this tissue factor is nothing but factor number 3. Okay, clotting factor number 3. So who is involved in extrinsic pathway? Factor number 3 and factor number 7. So 3 activates 7, 7 activates 10, 10 to 5, 5 to 2, 2 to 1. Done. So intrinsic pathway completed, extrinsic pathway is completed. Intrinsic pathway is activated by subendothelial collagen, extrinsic pathway is activated by tissue factor. Who are involved in common pathway? 10, 5, 2, 1. Now questions which you need to know for your exam is, sir, this extrinsic and intrinsic pathway, they are measured. Okay, they are measured with time. They are measured with certain studies. What are these studies called as? PT and PTT. PT means prothrombin time. PTT means partial thromboplastin time. okay, PT and PTT times. Now, which study is going to measure the intrinsic pathway? See, intrinsic pathway is big or extrinsic pathway is big? Intrinsic pathway is a bigger pathway. Okay, so 12, 11, 9, 8. Extrinsic pathway is 3 and 7, that's it. So, bigger name, you have to give the bigger name, that is PTT. PTT measures the intrinsic pathway. PT, prothrombin time, measures the extrinsic pathway. Okay, PT and PTT. This is also completed. Now, some students will have it out. Sir, here some clotting factors are missing. Which one is missing? 1 is there, okay, 1, 2 is there, 3 is there, 4 is missing, sir. Where is 4? See, clotting factor number 4 is nothing but clotting factor number 4, it is nothing but the calcium. It is involved in every processor. Okay, these all stars are the calcium. So, calcium is required for the activation of the factors. Okay, for the activation of every damn factor, you require the calcium. Okay, so let me write here calcium required for activation of clotting factors. So, this is one prerequisite. So, these clotting factors, where they are getting activated, don't think the clotting factors are getting activated throughout the body, no. The clotting factors are getting activated only here in this area. Only in this area the clotting factors are getting activated. Okay, why only that particular area, sir? Because only in this area there is phospholipids of the platelets. So, for the activation of clotting factors, what do you require is, one is calcium. Okay, for the activation of clotting factors, the one thing which is required is the calcium, and second one, what do you require is phospholipid layer. Okay, phospholipid layer of platelets. So, these things are required. Okay, so fourth clotting factor is nothing but the calcium. I have shown you calcium is required. Now, who else is missing? So, 1 is there, 2 is there, 3 is there, 4, then 5 is there, 6 is not there, 7 is there, 8, 9, 10, 11, 12. Everyone is there, but what is the 13, sir? Clotting factor number 13. Do you know what it will do? So, the clotting factor number 13 is called as a fibrin stabilizing factor. Once fibrin is formed, that fibrin need to be cross-linked. Okay, properly cross-linked so that it will have a better strength, better tensile strength to hold the clot properly. Okay, so the last thing what happens is, sir, is a fibrin stabilizing factor. Okay, so factor number 13. So, fibrin stabilizing factor. What it will do? It will cross-link the fibrin so that it will become better tensile strength. So, primary hemostasis completed and secondary hemostasis is also completed. Now, some important points I want you to know. Sir, look, always in our body, okay, always in our body, there is some amount of, like, I should say, there is a balance between clotting factors and anti-clotting factors. You know the clotting factors, okay, 1, 2, 3, 4, like, 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13. These are the clotting factors. And there are also anti-clotting, like, proteins which are present in our body. What are the anti-clotting proteins? Okay, anti-clotting proteins. The anti-clotting proteins are protein C and S. Okay, protein C and S, these are anti-clotting, and there is always balance between clotting and anti-clotting things. If there is an imbalance, for example, because of some reason, the anti-clotting factors are going down. Anti-clotting protein C and S is going down, so it becomes relatively high. The clotting factors will become relatively high, and that can cause us hypercoagulable states which favors the clot formation unnecessarily. That's a pathological condition. Okay, so one point which I want you to know is the anti-clotting proteins are protein C and protein S. Next, what else you should know for your exams is, so these clotting factors number 2, 7, 9, 10. So 2, 7, 9, 10 clotting factors, for their activation, okay, for their activation, what do you require? You require gamma carboxylation. So these clotting factors need to be gamma carboxylated. Gamma carboxylation. Gamma carboxylation is required. Okay, so which enzyme is going to do? Vitamin K. See, vitamin K reductase. Okay, vitamin K reductase. Okay, so with the help of vitamin K. The enzyme is also vitamin K reductase. Vitamin K reductase. With the help of this enzyme, vitamin K reductase. Now what is happening? There is gamma carboxylation of 2, 7, 9, 10, so that the 2, 7, 9, 10 are going to be activated. Okay, 2, 7, 9, 10. These are gamma carboxylated proteins. Now they are like functional. Now they will become functional. Okay. But question is, during this process, this reduced vitamin K, okay, this is the reduced form of vitamin K, sir. Okay, this is the reduced vitamin K. Now it is getting converted into oxidized form. Okay, oxidized vitamin K. Okay, so vitamin K, the important points, look, the vitamin K, okay, the reduced vitamin K, with the help of this enzyme, vitamin K reductase, what it is doing? Gamma carboxylation of 2, 7, 9, 10. So that the 2, 7, 9, 10, not only same 2, 7, 9, 10, protein C as well as protein S, they are also gamma carboxylated. Okay, so all of these are activated. But during this process, the vitamin K is getting oxidized itself. But which form of vitamin K is required? See, continuously we require reduced vitamin K. So this oxidized vitamin K, it need to be brought back. Okay, you need to bring it back to reduced form. So who is going to help in that process? Vitamin K epoxy. Okay, vitamin K epoxygenase. So vitamin K epoxygenase is helping in this process regeneration. Okay. Now there is a drug called as warfarin. Okay, there is a drug called as warfarin. I hope you have already studied about this drug, warfarin. Warfarin is anti-clotting. Okay, anti-clotting, anticoagulant. What warfarin will do? Warfarin inhibit this enzyme vitamin K epoxygenase. Vitamin K epoxygenase is inhibited. When vitamin K epoxygenase, when it is inhibited, do you think the vitamin K is regenerated back? This reduced vitamin K is regenerated back? No, it's not available. So what happened to the activation of 2, 7, 9, 10 protein C and protein S? Gamma carboxylation is not happening. So these factors are not going to be activated. So without these factors, do you think clotting will happen? No, without these factors, clotting will not happen, sir. So by giving this drug warfarin, I used to remember like warfarin, war during war, killing will happen, killing. So warfarin inhibits the vitamin K production. Okay, that is reduced vitamin K production. Warfarin inhibits vitamin K. So no activation of 2, 7, 9, 10. Without 2, 7, 9, 10, no clotting. So it's an anticoagulant. Okay. So in this class, what we have discussed, in this video, what we have discussed is what is normal hemostasis, that is primary hemostasis as well as secondary hemostasis. Again, I am telling you, in primary hemostasis, it's all about the platelets doing the platelet plug, platelets forming the platelet plug. In secondary hemostasis, it's all about the clotting factors by intrinsic pathway, extrinsic pathway and carbon pathway, helps in conversion of soluble fibrinogen into insoluble fibrin and the fibrin stabilization. So with this, the first video in the topic of platelet disorders is completed. See you in the next video with the topics of disorders of primary and secondary hemostasis disorders. Thank you.